You are joining Making a Difference with Melissa Clark, a new show that shares the compelling stories and voices of well-known and everyday people who change the world in big and small ways. Enjoy our guests, call in, or just listen to be inspired. For this show was made with you in mind. Please join us every Saturday at 2 p.m. Eastern Standard Time with our special guests. And you can listen to our recast at www.melissaclarkshow.com.
Hey everybody, my name's Misty Huffman. I'm a registered respiratory therapist and I focus on critical care. And I did a semi-viral rant after taking care of a couple very critical patients. And I had seen, I'm from Michigan originally, and we have some major protests going on there that are very hateful in nature. And what I had hoped when I had come out here and I had seen what my counterparts were going through, that the country would unify and come together and work together to get through this. And what I'm seeing is a lot of division, and united we stand, divided we fall. I manage a Facebook page called Journey of a Combat Veteran Spouse that focuses on PTSD awareness. And these two have kind of tied in together, and I had done that video just for my friends and family to see what was going on and understand why it's really important for us to arm ourselves with knowledge and not fear. Take the facts and take the political out of everything and understand that we really do need to come together. Taiwan's got a really great model that they did, and they've had 7 deaths as of right now. And if we were as united as they were with our democracy, we could make this happen. And I just want to focus on education and make people aware with facts so they can make informed choices about their own personal beliefs. I don't care about political or party lines. And that's really what this country should be about, is unity. And I just want to push the message of kindness, and we need to work together as a team, and we're going to get through this. It's scary for all of us, but there will be a light at the end of the tunnel, and if we unify and work together, we can make it happen.
Hey, Misty, thank you so much for joining us today. I know you must be exhausted.
Yeah.
Wow, thank you so much. We're so honored to have you here. How are you feeling?
I'm tired and sleep deprived because I'm switching shifts. I'm working some day shifts and some night shifts to fill in where the needs are. So, and then dealing with all the questions from the Facebook page. Definitely educating right now.
You're coming to your hotel and you're going right live on Facebook.
Pretty much.
You have a lot of followers, and people are trusting what you're saying, and we thank you. I trust what you're saying because, you know, you've told me that you educate yourself before you give information out. So we're just over the moon right now. I want to ask you, why did you make such a bold move to come here from El Paso, Texas?
Well, when I went into respiratory, I always wanted to travel. That was kind of my goal. And I got married, and now I'm getting divorced, and I've been in El Paso at my former position for a year, and I figured now is the time to get back into it because, like I said, I'm really big on education, and it's easy to sit across the country when because we have a Facebook group for respiratory therapists, and I started to see the posts about how overwhelmed they were out here. Yeah. Because, you know, you see the news, and I really don't watch television. I try to go to the facts. And then I started to see my counterparts getting buried with work. I mean, the workload for a ventilator in a normal ICU is like 6 to 8 patients, like max, and they're getting up to 20. So I was like, you know, this would be a good educational experience and definitely hands-on. You do have to be hands-on in the clinical practice to even understand a lot of this. It's easy to read it in a book, but until you actually deal with it, those are two completely different situations. So mainly for education and plus to help out. I mean, we all have to pitch in. There's not a lot of us respiratory therapists.
That's right. That's right. When did you come here?
I got here mid-April.
Mm.
I had went to Seattle first, and our contract got canceled before we started because their needs started to go down.
Mm-hmm.
But then this began to pop up. You know, New York's always been a hot spot, but Washington was, I think, one of the first. And so I got home for a week and had to quarantine, and then I flew out here, and been going pretty hard ever since. And I did a live video on my personal Facebook page when I first got out here.
Mm-hmm.
And that got like 5,000 views. I shared it in our Nextdoor app. It was just kind of like a Facebook for your neighborhood.
Right.
And it just took off. It was really crazy. And it was just a candid experience about what I seen my first week here. So I just kind of kept the chronicle going. And when I ranted that night in the conference room, I always look for teachable moments. And I had just sucked out that mucus plug, and it was in the shape of the airway.
That's
And
right.
I happened to be right there, and I'm like, this is where it came from, and this is what's going on. And people, I don't know how it wound up getting so much popularity and who shared it and how it, I mean, I don't even know.
It's amazing. Now I gave a disclaimer in the beginning because, you know, I just want people to know that we are going to get down and dirty with a lot of questions, and I want you to be very honest of what's going on. So kindly tell us what happened when you first got here. What did you see?
I don't really know what I expected. I just kind of knew that, you know, I was going to have to wear my PPE. It was going to be a very hot, sweaty, and uncomfortable thing, and I was still going to have to do my job, but I was not expecting every patient in the ICU to be infected. I mean,
Wow.
usually you have a couple different cases. You know, you have your medical and your surgical, and since those have all been suspended, you know, you still have like other health issues that you have patients in the ICU for, but every one of them was COVID. I mean, every room, it was just from room to room to room. And, you know, there's no break from it. There really isn't. I actually had my first patient the other day that's talking. He's, you know, he's not progressed to needing a ventilator yet. And I could actually really communicate with him and get him to understand, you know, hey, we need you to do these therapies because your outcome is not favorable. And I had to use a little bit of a scare tactic, but I also educated him to make the choices that he would need to make for his care, you know, and at least he could make those with all the information at hand that we have. But it's very much COVID, lots of COVID.
Mm-hmm. And tell us what does a patient go through when they're in the ICU?
It all depends on their severity, but once they've progressed to needing a ventilator, like normally, you know, we're in and out of the rooms, you know, if the patient needs something, but everything, all the IV lines are outside the room, so the nurses don't have to go in for their IV pumps, and you really limit the amount of times that you go into the room for exposure. So it also limits that time with the patient, because I'm going to tell you what, even under deep sedation, they hear you and they do remember. You know, I was just talking to our director about a situation that I had at a prior position, and we had kind of shared experiences, and when they do remember. So you always talk to them like they're there and listening, because they are there. And you know, the first one I had that had passed by themselves, I could see, you know, there's just certain things after, you know, you've been doing this for a long time in critical care. When you're looking at the patient and an ICU monitor, you just know when it's going to happen real soon. And I had went in the room and I grabbed the man's hand and I'm like, you're not going to die alone. And as soon as I did that, he went asystole and he was gone. And I'm like, oh my God, you know, it was just really, really shocking.
That's nice. Sorry.
I
I get very sensitive.
It's okay. And it's actually really good that you do, because we're all kind of doing that collectively in the ICU. You know, we're not really letting these people pass alone, and they are doing like FaceTime with the family members from their personal phones. And, you know, trying to do the best we can with the resources that we have. And, you know, it's just, it's hard. It really is. There is going to be some trauma after this. And I'm at a smaller facility. I'm usually at like really large trauma centers, but our facility is actually smaller, which makes us even more close-knit of a group, you know.
Yeah.
They accepted me as part of the family. You know, usually it's kind of like, oh, the new girl, does she know what she's doing? And then they're like, oh, okay, she does. And then they see the level of care that you give, and they know that you're going to treat their patient well. You know what I mean? So you just kind of form this bond very quickly, especially in this. I mean, wow. Everybody knew my name by the end of the week, and it's really hard when you're walking around the ICU and everybody's got masks on and PPE. You can't tell who's who. And I'm like, they know my name. You know, it was very, very humbling.
I'm sure. How long does it take you to get into your gear when you first go on your shift?
We're wearing, some of us have the white Tyvek suits, which those work better for the men because they can stand up to go to the bathroom.
Mm-hmm.
What we've been doing is wearing the Frog Tog rain suits over our scrubs. And then we have a surgical gown that we put on. And then over that, when we're upstairs, we have a disposable gown that we take on and off every time we go in and out of a room.
Wow.
And then we have the hair bonnets, and then whatever kind of, I wear goggles. Some other people have the face shields. I can't see in the face shields because they fog up with my breath, and we have 2 surgical masks on. I probably spend a good 10 minutes trying to get just into my stuff.
Wow.
And then getting out of it's even trickier because you have to take it off a special way so as not to contaminate everything, and then having to repeatedly wash your hands. And then we have to wipe down our suits with the hospital wipes that they have to sanitize yourself. It's a lot. It gets hot. It gets really hot.
I'm sure
it's really uncomfortable, but when you're in the middle of chaos, you really don't have time to think about it. Honestly, you just do it.
How many of your coworkers are getting sick?
Before I got there were several, because we just had a few guys come back from being off, and they were off since April 7th.
Wow.
And so this has taken people down for like 30 days or more. I've talked to a few other people that were infected. We lost a coworker. There's several that are positive. It just all depends on the severity, though. The one coworker that I talked to the other day, he said that there was a point where he just wanted to die. That
Really?
He just felt, yeah, because what they're finding now in the autopsies is that this is actually getting into the spinal fluid. So it's affecting the brain, which causes meningitis, which is an inflammation of the brain meninges, which causes odd things to happen. And we're sitting there going, there are a lot of patients that we cannot control on the ventilator. I'm like, this is all neurological, because I can tell from working with stroke patients and traumatic brain injury patients that there's just a breathing pattern that they take on. And I'm like, this is almost neurological, and it sure enough is, because it's affecting the brain. And that's where your respiratory center is in your brainstem. So if you get any swelling and anything, it really does affect your breathing pattern, and you either have to paralyze them to get control, and there's a lot of negative side effects to that. So we're trying to keep them as awake as possible to be able to cough, because once they get on that ventilator is when that storm starts, because when they first come in, they're dry. They don't have mucus.
Mm-hmm.
But when they get put on that ventilator, all that lining and that's what the goober that I had posted.
Yeah.
I actually see that, and it's all the cells that have been shed, and it just creates this nightmare. It's an uncontrollable nightmare is what it is.
Tell us about the ventilator. A lot of people are petrified to even know about it, and they're saying that it doesn't work. What's your thoughts?
It does, but and I have the statistics here. When this first happened, this all first began to come out, and a lot of us in the medical field were like, oh, this is just another virus. And, they bash the government now for saying that, but we all thought that. And we were going off the data that we had at the time. Whether it was inaccurate or not, that's what we had.
Yeah.
And now, back then they wanted us to do early intubation, which is putting in the breathing tube, get them on the vent early. Don't let this happen. Well, as we got them on the ventilator, these people are on the vent for like 2 or 3 weeks. We don't like you on the vent any longer than you have to be. My average flu patient, I would say like 6 to 7 days max is what my personal experience, unless they have like some major other health issues going on. But these people are on it for like 3 weeks, and it creates a lot of problems. But what we are seeing is that the strategies that we were using for treating ARDS, which is acute respiratory distress syndrome, which is what this presented as in the beginning. So we started to treat it that way. Well, it is most definitely not. So now we're doing everything we can to keep you off the ventilator.
Wow.
And between the ages, and these were from the New York admissions, and between the ages of 18 to 65, if you do not have to go on a ventilator, your mortality rate is 19.88%. If you go on the vent, 76%. And then with the age greater than 65, it's a 26% chance of mortality without the vent and 97 with it. So it's almost like a death sentence.
Wow.
So we're doing everything we can to keep it off, because once we put you on that vent, it seems like that's when the storm starts. That's not normal. We don't see that with all these other this is why this is not like the flu. We don't see that with everything else. We don't see this level of it. I mean, the inflammation that is happening, not only in the lungs, but throughout the body. The numbers that we're seeing in the lab work is absolutely off the charts. I mean, it is so high, you're just standing there looking at the labs going, is this accurate? Because we don't see this. And traditional medicine that we normally use is not working.
Right.
So everything that we're trying is not working. And the vent, normally it moves the gases. It brings you oxygen and it gets rid of the carbon dioxide. But what's happening is the air sacs at the base of the lungs, there's this capillary membrane where the gas exchange takes place. And what happens is what's called a shunt. It just kind of bypasses it. So that gas exchange doesn't take place. And normally we use high pressures to hold open those airways and help to push the gases through, but that's not the answer to the problem. That's actually what's causing some of the problem, is these high pressures. So we've completely reversed our ventilation strategies. So everything we know is wrong, and it's really hard, because there's like, you just stand there wondering, what else can I do? And a lot of times the answer is nothing. It's just, there's nothing.
What has changed now from when you first started? What change have you seen?
A lot of it is the ventilation strategies. We were using the high pressures and the high PEEP, which is your expiratory pressure. If you think about it like a CPAP machine that the people wear at night to sleep, it has that back pressure.
Yes.
Well, it's just jacked up really high to stent those airways open. But that's not what, because like I said, this developed a lot like ARDS in the beginning, and what we're finding is obviously it's not responding, so we're not using those high pressures anymore. We're trying to use a more protective lung strategy is what we call it. So there's like lower volumes and these lower pressures, and we've really changed that approach, and it's made somewhat of a difference. I mean, honestly, once these folks get on the ventilator, it's almost up to the human body and your own immune system and its genetics to get you through that part of the storm, because all we can do is kind of support the body to try and help it get through it. I mean, a lot of people ask about Ecmo, which is where there was a child that was just discharged here in New Jersey today, which is awesome.
Thank God.
Dear God, I love hearing happy stories, but she was on the Ecmo, and she had a blood clot in her leg. And that's what we're seeing with these patients is the thick blood and they're getting clots. But it takes the blood outside of the body. Well, a lot of people are like, why don't we do that? Well, because it's not readily available. There's very limited amounts of these apparatuses, and we can't just put every patient on one because the involvement of the medical staff just for one of those patients is astronomical. And then we just don't have the resources available to do that. In Texas, like the nearest one would have to be flown like 8 to 9 hours away just to do something like
Wow.
that. And you can't fly an unstable patient.
Right.
And then that's another thing. Number one, we're not transporting people just to reduce the spread. And we can't transport an unstable patient. If something happens, we have no means within, an ambulance or a helicopter to take care of that amount of, because there's a lot involved with these patients. There's a lot of drips, which are the medications, and the IV pumps, and all the tubes and just everything. And when you have like a 2-person team in a transport, your hands are kind of tied if something goes wrong.
So you came here in April. Is somebody still on a ventilator from when you first put them
Yes. Yep. I have 2.
Wow.
I have 2. And then there was another one that was put on the vent like the day after I got there, and they're still there. And their prognosis, I mean, they are off. A couple of them are off of the sedation, so there's nothing being used to sedate them, but they're not waking up. It's just kind of like the body's natural, responses. Like if you stick a toothbrush in the mouth to scrub the teeth, they'll naturally want to suck on it because it's in their mouth, but there's no eye-opening responses, no nothing. And it's the hardest thing to watch because you just get so hopeful, like, okay, we're taking off the sedation, we're going to see if they wake up, and then they're not. I've had one successful patient come off the ventilator, and he's still in the hospital, but with his fighting spirit, I'm hoping he'll be walking out of there soon. But there's always these complications that keep arising. It's like just when we think we understand it, something completely off the wall happens. We have a lady who got sick and had tested positive on like March 20th. And she just had some very, very mild, very mild symptoms, nothing to really complain about. She came in on May 7th in respiratory distress, and she's on the ventilator. So 6-7 weeks later, after the initial, now we're like, okay, is this a relapse? Is this what is this? What's happening? We don't know is the answer to all of these questions. And, you have everybody, wants an answer right now, and we can't give it. We don't have it. We need time. That's why we need people to please listen. It's like, God, if we could only get you to understand, how bad this can get if you just continue to spread it. I understand that people want to go to work and have an income, but you can't do it if you're dead, because what we're seeing with all these places that are reopening is people are not maintaining their distance. They're running out like a herd of cattle and just going right back to the way we used to do things, which is why we have flu outbreaks every year. We tell people this every year: wash your hands, wear a mask when you're sick, and nobody listens. And it's like, you would hope that was something like this. And now, because the numbers aren't bad like they thought they were going to be, now, everybody's attitude changes. And it's like, these numbers, they don't understand what they're talking about. What the news talks about is the case fatality rate, which is the number of people infected and the number of deaths. And what we really need is the infection mortality rate, like how many in the population have been infected, and then compare that to the amount of deaths, because that's the number that we need, because that's also going to let us know where it falls with what's called herd immunity. And we don't have these numbers, and people are comparing it to the flu, and that's like apples to oranges. Like with the flu, herd immunity reaches like around 50%. With the mumps, it's 90. So there's a big difference between these things. You know, they don't understand, and the media is not helping by not giving them that information when they report it. It's just these big scary numbers, and they don't understand. And I think that's why the live videos are working out so well.
Yes.
Because people have a live interaction and ability to get an answer to their question immediately. And the first night that I did that first live video after like that, my rant went kind of semi-viral, there was like 200 people that tuned in that night. And I talked for 3 hours.
Wow.
I had to work the next morning, and I looked at the clock. I'm like, oh my God, I need to at least try to lay down. And I could not believe when I ended the video how long, but everybody's got really valid questions. They're not bad questions. They're not. They're really, these could easily be answered if we use the media for something a little bit more positive and hopeful and interactive. And now it's just, they focus on the negative, and it gets people worked up and scared. And I don't want people scared and in fear. I want them knowledgeable and armed with the information to make rational decisions, I guess is the best way to put it.
Let's discuss that. We'll take a break with the hospital right now. I want to discuss what you recommend when people go out from when they leave their house to the time they get home.
The most important thing that we are taught in healthcare from the day one when we enter is the single most important thing for infection control is hand washing.
Sure.
You need to be mindful of what you touch. You know, like if you touch a doorknob, you know, especially with it being like if it's a metal surface, we know that this virus is easily spread on a metal smooth surface. It lives for several hours on it. So if you touch a doorknob, wash your hands. What I don't want people to do is wear gloves in public. I don't know. I have so many businesses that I walk past, and I see these recommendations of demands of wearing gloves. But what that gives you is a false sense of security.
That's right.
So you think because you have these gloves on that you're safe, and then you're doing things that are harmful, like touching a million other things, touching your phone, touching your car steering handle. Like my Uber driver had gloves on, and I'm like, where have you been with those gloves? And how long have you had them on? We have to take our gloves off if they're soiled, but with this virus, you can't see if they're soiled. But you will be mindful if you wash your hands and go touch something. You know what I mean? So, and then people put their phone up to their face, and I'm like, oh my God, you didn't. I have stopped people in Walmart. I had to quit going to Walmart. I had to stop because everybody I seen doing that, I would say something and point it out because it's a subconscious behavior. It's become a repetitive action. So you don't even know that you're doing it half the time.
So if you're touching say you have gloves on, okay, you touch a door, you're supposed to take them off right away.
You are supposed to take them off and in a special manner to where you're not contaminating your hands underneath and, you know, spreading. And then you need to go wash your hands and put on a new pair.
Right.
But you have people walking all over the store for an hour, touching things, doing things. And if you just had a hand sanitizer in your pocket and you went from, you know, especially people going and handling produce.
Yes.
How much, you know, how many people squeeze the lemons and the melons before they buy them? You know, so you definitely want to be washing your fruit and vegetables when you get home. Don't, dear God, don't even, I wouldn't touch it without washing it. But they're actually contributing to the spread. I shared a video a while back that my dad sent to me of a guy who, and we've done this in orientation just so we had a knowledge of how easy it is to not wash your hands completely or use the sanitizer right. But they used a blacklight powder in a third grade classroom, and they just had put it on the teacher's hands, and she shook 3 random children's hands, and then they used one other child that they actually had put it on. When they went to recess for lunch and they did the black light, it was all over the classroom. And you're just like, oh my God. And when we do that in orientation, they do the same thing. Go wash your hands like you normally would. And then they hit you with the black light and you see everything that you missed. So even if you think you're doing it right, you more than likely are not. So even like taking the gloves off, and you know, a lot of people aren't going to wash their hands. They're just going to put another pair of gloves on, which your hands are already dirty because you probably didn't take them off right. So
Right.
it's just this false sense of security. So I would honestly, unless you have to go to that store and they insist on you wearing those gloves, I would wear them and touch when healthcare workers generally go to the store, we go in and we touch as little as possible.
Correct.
You know, I don't even grab a hold of door handles, and I hate bathroom doors that I can't push with my foot or my arm to get out. I don't want to touch it. It's like I just washed
Yeah.
my hands. And now you want me to touch a door handle because people don't wash their hands after going to the bathroom.
Right.
So I just go to the store and I touch as little as possible. I carry my sanitizer with me. And when you use sanitizer, you have to use it like it's soap. You need to put a good amount in your hands to where you have to do this for 20 seconds and it being wet, because your hands have to be in contact with the alcohol.
Hmm.
And usually on the back side of the hands here and in the fingernails is where it's not cleaned, and that's where the bacteria hides, especially under the fingernails. I hate the healthcare workers that have the fake fingernails that are 9 miles long. I'm like, I don't even know how
Oh,
you do healthcare, and that's not sanitary, because
yeah.
no. And the mask situation, I know the Surgeon General had said, you know, and he is correct, and now the CDC says something different, but
Hmm.
again, the masks give you a false sense of security, and people are not taking them on and off right.
Right.
If you touch it, you go wash your hands and you throw it away. You don't put it back on. We get a stack of masks when we get to work. We get a bag of our PPE, and there's multiple masks in there because it's not meant to be worn continuously. So if you're touching the outside of it, that's where everything's at that you don't want to touch. And then if you touch the inside, it's your own bacteria, and you don't know if you're contagious sometimes. Some people don't have symptoms. So what they have found with a lot of studies, normally you touch your face about 16 times an hour.
Right.
You double that when you have something on your face that you're not used to wearing.
Correct.
So now you're touching it more and fiddling with it and doing all these things and then touching everything. So it's not helping. It is not. And the cloth masks, I think it's more helpful that it's catching the droplets from you, not protecting other people from you or you from other people. You know what I mean? Because
Hmm.
it's not the same micron filters that you would get in the surgical mask, but it does help prevent the spread. But I think everybody wearing them is kind of a ridiculous notion at this point. What we usually do in healthcare is if you're sick, you wear a mask so you don't spread it. If
Hmm.
you're immunocompromised, if you are on chemotherapy, you wear a mask to protect yourself. But having everybody in the population wearing a mask is just making this worse. But we have to follow the guidelines. So, you know, wash your hands, be mindful of what you're touching. Do not touch your eyes, your nose, your mouth. Touch as little as possible, but don't wear gloves in public. Please. I mean, I cannot beg enough of that. But
It
always
make
be mindful.
it makes me laugh because the governor told us we have to wear
Mhm.
masks. So, and then people lost faith in Dr. Fauci.
Yeah,
So,
they did.
so now we don't know what to do. But
What
now,
you have to do is look at the research,
mhm,
honestly. I mean, we have to do what we're told right now. And,
right,
you know, it's better that everybody wear them. That way we don't have one group going, it's not fair, because you know that's going to happen. But what we need to do is teach them how to use it. You know,
sure,
putting up signs and posters doesn't help. You know, if you're going to do this and mandate it, you need to be widespread with education on how to do it properly. Because let me tell you about healthcare. We have a lot of hospital acquired infections, and
mhm,
there's only one way to get those, from healthcare workers not washing their hands and carrying bacteria to another patient.
right,
And I've seen it happen. We had one patient with a really abnormal, something we don't see all the time, and all of a sudden 2 other patients popped up with it. There was only one, and it was in
really,
completely different areas of the ICU, and there's only one way for that to happen. Somebody didn't disinfect properly. So if that's happening in healthcare, where we are it's driven into us from day one that you need to do this and you need to do it right, and it's still not being done right. Imagine the rest of the population on how many people are not doing it right.
Mm-hmm.
So you're better off not increasing the risk. But if you look at the research and go to the facts, and that's another thing, people don't know where to get the information from anymore.
That's right.
I get sent so many links about what do you think? I'm like, number one, look at where it came from.
Mm-hmm. Yeah.
If it's not citable by a medical research paper, or it didn't come from a medical journal or a medical association that that does this, they do all that research, it's more than likely not credible. If I can't put it in a research paper or one of my college essays as a citable source, it's probably not accurate. WebMD would probably be like the best place to go for people looking for health information.
Mm-hmm.
They, like the health insurance companies, do a lot of stuff through WebMD, and that's a pretty credible source.
Right.
If you want to do the Google thing, but you really need to read the research, and the research shows that these things are not helpful.
So I want to just reiterate really quick, because this is a big problem, and I reached out to my Facebook friends and they wanted to know about the mask and the glove situation.
Mm-hmm.
Then we'll go on, because I know you mentioned it. Let's just reiterate.
Yep.
Do not wear gloves.
Do not.
Okay.
Do not.
Wash your
Do
hands. Wash your hands every time you touch something outside of your home.
Yes. Just watch what you touch. If you don't need to touch it, don't.
Mm-hmm.
And
Sure.
keep your hands off your face. I mean, it's almost like when people are trying to quit biting their nails, you have like a cayenne pepper that you can put on it.
Yeah.
You would realize how much your face is burning because you're mindlessly touching it when you don't realize it. If you had cayenne pepper on those fingers every time, you would know it, and you would realize real quick how much you touch without even thinking about it. And just don't.
Sure. Okay.
Don't touch.
The mask, we have to play the game right now, so we're going to play the game. However, if you do have a disposable mask, as soon as you touch it, get rid of it.
Get rid of it, and you want to grab it by the loop
Mm-hmm.
around your ear and let it fall. You don't want to play with it. I see a lot of Uber drivers, there's a lot of people who are making fun of others for riding around in their car with their mask, but they're doing it right because they're not taking it off and playing with it.
Correct.
Because they really don't, they have sanitizer, but just leave it on. If you're going to wear it, just leave it on until you are done, and then take it off. Just don't fiddle with it. Don't take it on and off. Don't pull it down under your chin. That's just spreading bacteria all over your face, because now you got the outside of the mask touching your face. And, don't let it hang down under your nose. You need to cover everything and just leave it alone. That's really important with the mask.
Yeah, I think about that as well, because I live in an apartment building. So when I take my dog out for a walk, I have the mask on. When I get outside, I really want just fresh air. So I do pull it down here. What are we going to do? I pull it down here and it's sitting right here. So all those germs are sitting right here. And if it wants, it can creep up. So thank you very much for that. The cloth ones, as soon as you take it off, you got to wash them. I mean,
throw it right in the laundry, right in the laundry. And honestly, we have enough of the surgical masks. I mean, they're available on Amazon. I just shipped some to a lady who doesn't have the means to get any. I see them at Walgreens. So we have the surgical masks available. So I know they say to save that PPE for us frontline workers, but those are available. What we don't have available is the N95s for the airborne particles. So I would honestly encourage people to use the surgical mask, the disposables, over the cloth, because they are going to provide more protection. The cloth masks are very, I just have to laugh when I see them, because they're just not.
This isn't a fashion. This is becoming a fashion show.
And it's becoming a fashion show, and they're like in these interesting things, but the fabric is just not there for protection. You know what I mean? It's just, you can breathe through that. Droplets can still spread through that. they're just not helpful. There's the research behind it. I follow Z-Dog MD. He's an awesome doctor. He's Stanford educated, but he always says, science the crap out of it. And it's true. Science the crap out of it. Go look at the science. If you have any doubts, go look at the science, and the science will tell you it's not protecting you from anything, but maybe some dirt particles. That's what I used to wear on my husband's on the back of the motorcycle to keep the sand out of my mouth, you know?
Yeah, yeah.
Maybe for something like that, but for droplets, and no, because you can still cough and spread that out, that fabric.
Okay. With the surgical masks there, the disposable ones, I have one over there. I'm sorry, I don't have one over here.
I got one right here.
Yeah. My question to you is, yes, thank you. I received a lot of them and they came from China. So people are afraid of that. What's your recommendation there?
Oh my gosh. The surgical masks from China, I would say, are fine. What I have a problem with are let me grab it real quick.
Sure. Thank you.
I do want to show the difference, because I refuse to wear these at work.
Okay.
The KN95s. Now, if you're wearing it out in public and you're using it in place of a surgical mask, great. If you are up in the face of somebody who's sick, not so great.
Sure.
So this here is the KN95, and you can see it.
Mm-hmm.
You see how it loops over the ears like a surgical mask?
Yes.
A real N95, you have to be able to form to your face. And I have a new one here. I've smushed the living daylights out of it, but this one here has loops that go over the back of your head.
Mm-hmm.
Because you have to seal it. We have to be fit tested for these, which means they stick you in this hood and they spray this nasty tasting saccharin spray, and they have you say a bunch of random things. And if it goes through, it means that it leaks. There's no way to seal one of these. And when I wear one, all my air comes out my chin and I can feel it. Now, if I'm in the face of somebody who's sick, this is the last thing that I want. So the Chinese mask that I would have the most problem with is this one.
Sure.
You could use it in place of a surgical mask, fine. But if you are seriously up in the face of a patient who's coughing or a family member who's sick, this is not what you want to be wearing at all. And these are the ones that we can't get our hands on right now. And they're restricted for order only by businesses. So the general public, they went and cleaned out Home Depot out of these.
Right.
And that's why there's no more available there. So what they did is they restricted the ability to buy them. But the Chinese standard for an N95 is different than the United States. And that's what, you need to be worried about. Definitely okay in place of a surgical mask, but it does not replace the N95 that you can seal, because that's what you want, is a tight seal. Mm-hmm. So nothing's getting in or out. And I actually wear this, and then I have to put the surgical mask over it to help to keep this clean, because we're so limited on these. Even though they've ramped up production, we're still having a hard time getting these. And a lot of hospitals are, like my hospital that I left in Texas, we were not to throw these away because they were sterilizing them to make a collection if we had to use them again. They were still giving us new ones if we needed them, but they were saving them because they didn't want to be short or left in a situation where we would be short on them. So there is a difference with the masks, and that's why the cloth mask, you really have to look at the standards. And even like feeling these is even the thickness is different. Yeah. So I can understand being worried about China, because they did send over a bunch of N95s that did not filter the way that they said they did. They didn't have that rating that they should have. So I would be wary, and they're ordering stuff from 3M from our country to take care of their people. Right. So, yes, I would be wary. if you are actively around somebody, and you really have to be close up in somebody's face to get their droplets. You know what I mean? If you're
Sure.
maintaining social distance like you're supposed to, you know, stay in your space, you're not going to transmit that, because it hangs in the air for a few minutes, like right outside, and then falls to the ground. It's not an airborne virus like tuberculosis is. Tuberculosis hangs in the air.
Mm-hmm.
This only hangs in the air if you're like me and right up in the patient's face, you know, and it's, I have to be there. Or if they're aerosolizing, like the nebulizer treatments, like if we have a COPD patients who still need their breathing treatments, that level of protection, you know, that's what you need the N95 for, and that's when you need to worry. But overall, just for a general mask wearing, the Chinese stuff should be okay.
Okay. Do you recommend eyewear?
Yes, yes, absolutely, yes, yes. I have, I have my goggles.
Yeah.
Because like I said, I can't wear the face shield. So if you are going to be, like, if you're taking care of a loved one and you have not been positive or symptomatic, if you're going to be taking care of them, protect yourself. Absolutely. This is what I wear over my glasses.
Wow.
We
Wow.
all walk around it. We have some people with the giant 3M respirators that have the huge filters on the end. It looks like something from Deep Space Nine or something, you know, but who cares? We're not there for a fashion show. We're
No.
there
Mm-hmm.
to be safe. But what started that rant was there was an image on Fox News, and there was some angry protesters in Michigan protesting their rights and everything else, but there was a line of police officers and they had their face masks on.
Right.
And these protesters were obviously angry and screaming, whether, I don't care who they were screaming at, they were too close to the cops, and the cops had no eye protection. So if any one of those people were asymptomatic but were carriers, it would have easily been able to transmit that way. So yeah, I do recommend eyewear. Anything to protect any mucous membrane. You know, if you're going to be that close or put into a situation where you're going to be that close to somebody, definitely, definitely.
Can you explain ARDS in layman's terms?
ARDS is acute respiratory distress syndrome. It is an inflammatory situation where the lungs get inflamed, and you can't, and they get very stiff. And when you have it, and we refer to that in respiratory and in the medical field as lung compliance. With a COPD person, they get that barrel-shaped chest because their air is all trapped in the lungs. So they got very compliant lungs. They're very elastic. ARDS is very inelastic. It's almost like trying to put air into a brick, is the easiest way to explain it. You have all the little pores in there, but you can't pass the oxygen through because everything's so swollen and inflamed, it just bypasses the whole membrane where the gas exchange takes place. What's happening with this is a cytokine storm. It's the body's immune response. And it releases all these different things when the immune system is like trying to fight something. So we have these inflamed lungs plus this massive storm. And when you get that massive storm, other things begin to happen in the lungs, which make the mucus that I had sucked out. We don't see that with the flu. We just see like some inflammation and some really stiff lungs, and then the swelling goes down and they come off the vent usually. That's not happening with this.
And the drugs that are being given to the patients, you had told me that the patients react differently to the drugs.
Yes, they do. What we're seeing is if it's began early, and here's another thing that you had asked me earlier about what we're seeing that's different now.
Yes.
We had told people stay home, don't come to the hospital, call your doctor. But if you get your butt to the hospital and we get that positive test and we start you on these drugs earlier, that's where the responses are, that we are seeing some kind of response, you know, whether it be not so long of a hospital stay or the survival rate, we have yet to know, but we do see the differences then. once you've gotten so far that the cytokine storm has started, we can't reverse that. There is no drug. I mean, they're trying all sorts of different combinations now. I mean, I was reading about the remdesivir trial and what they're doing now, and I didn't even know that they're adding another anti-inflammatory drug to it and going on to the next trial. So I was reading about that before we did the interview, and that's where Dr. Fauci works. So I know that everybody, you know, at first it was the hydroxychloroquine, but at the same time that everybody was hollering about the hydroxychloroquine, the doctor in Washington who had originally tried the remdesivir, because I had been reading about it prior to, you know, everybody losing it over the hydroxychloroquine. And I'm like, but what about this other drug that this doctor talked about? Why are we not focusing on that? But it was because of the media. They grabbed onto that drug for some reason I have yet to figure out, and forgot all about this one. But now we're talking about this drug because now it's the one that's the only one that's got the randomized controlled trial that it's moving forward with, and all these other things that are happening. But there was a huge controversy about that, about them even bothering to give these patients a placebo and just giving it to them right off. The problem is we're seeing like massive amounts of kidney failure. We have to pull people off the trials, you know, because this one you can give it for up to 10 days. Sometimes by day 3, they've deteriorated so much that we can't keep going with them in the trial. So the sooner you get in to get help, the better.
Yeah.
If your symptoms are getting so severe, that's another thing, you know, when to go to the hospital.
Correct.
If you are breathing more than 30 times a minute, if your oxygen level, a lot of people, those pulse oximeters are very cheap. If your oxygen level is hitting 93% or lower, get to the hospital. So if you're having that severity, then that's when you really need to go in. If it's just something mild, you know, or if you go to your family doctor, and a lot of times they'll order like an outpatient chest x-ray. If there's more than 50% of your lung involved with this inflammation, you need to go to the hospital because you only have half your lungs that are pretty much working at that point in time. But at home, the two things you can look for if you have a pulse oximeter is 93% or less. And if you're breathing more than, you know, and you can have somebody count how fast you're breathing per minute. It's pretty obvious if you're huffing and a puffing and you're usually going to be sweating. A fever is generally a good thing, because that means your body is responding to fighting the virus. You know, don't just go take Tylenol right away, because you're suppressing the body's immune system and its ability to respond to fighting. So unless it gets high, you know, then you know, obviously we don't want it really high, you know, 103, we definitely want to take something. But if it's just a low grade fever, let it be. Just don't cover, you know, up with too many blankets and make it go higher, you know, just let your body do its thing. Our bodies are a fine-tuned machine. They are, you know, they react to all these things in the environment. Some people need more support. And then, you know, when you get to this point, definitely get to the hospital, because we want to keep you off that ventilator. And early on with these drugs is what we're seeing. A lot of people, you know, they were having signs of a stroke and they weren't coming in. And now we're seeing that all, you know, African Americans are at higher risk for developing worsening symptoms, males, and overweight people with a body mass index greater than 30, because this is oxidative stress. This is not just a respiratory virus. It attaches onto these receptors in the lungs, and then it just replicates itself like crazy. And then it goes and affects the blood vessels, which is why we're seeing, we believe, all the blood clots. So we want to prevent that storm from happening. So the sooner you get in and we can get you on these medications and enroll you in the trials, the better. The better the outcome is going to be. So, you know, don't avoid going to the hospital.
Because you're scared,
Yeah, it's not such a bad, scary place. There's not really many people in there right now.
That's great.
Go Go ahead.
Sorry. Tell us what happened the other day. You lost 3 patients, and now
Yeah,
if
it
you
was
could.
just like all of a sudden, it was like everybody was going downhill at once, coming up from the floor, from the emergency room. I had to withdraw support. I lost one patient. I went in to do the ventilator check, and I'm like, I was just in here an hour ago. You know, I could tell that her prognosis was very, very, very poor. We have what's called agonal breathing, and it's kind of, you kind of look like a fish out of water. You just kind of gulping for air. And when you do that on a ventilator, it's not a good thing.
Wow.
So I knew it was going to happen. I was trying to explain to the resident doctor, because they're still very much learning. This is definitely a crash course in a critical care, because a lot of them will go out to like a family medicine or neurology, or they'll go to their, entire specialty. Not all of them focus on critical care, so they're not used to seeing this. The attending doctor cannot be there at all times, so we do have the residents, and that doesn't mean that you're getting bad care, but they're not used to seeing it like we are, and all these signs and symptoms. And he was trying to do everything he could with the vent, and I'm like, listen, sometimes you just have to learn to let it be. And if you look at your patient and this is what you see, the prognosis is not good. I can't reverse that. It's actually at that point in time, it's the brain and the respiratory center kind of dying out, and it's like the last a flicker of light. And no matter what you do with that ventilator, it's not going to change the outcome. And it's really hard to accept for a lot of people. And some people think that we're being cold-hearted, but it's emotion talking. It's not logic. If they knew what we did and had the experience, and we know, there's no CPR that's going to bring them back, that those functions are gone. And it's really hard. And then I had at the same time all of this was going on, there was a lady next door to my guy who's actually talking, hopefully still when I get back tomorrow night. But she was on the vent, and I thought she was going to come off, and I got to work the next day, and she was like upside down and prone, because that's what we're doing, is we're proning these patients. That's another thing I do want to talk about, because you definitely want to do that even if you're at home with this, because it definitely helps. But she was, having me wet her mouth, because obviously you can't drink when you're on a ventilator, but her and I were signaling and talking, and she was writing me notes, and now she's not. And this is the one that was sick back in March that just came in with the symptoms. And I'm just like baffled. We're all sitting here going, what is going on? And then another patient that I had that we were trying to keep off the ventilator, who wouldn't prone, he was uncomfortable and he just wouldn't listen. He wound up on the ventilator, and we've been proning him on the ventilator now. So he didn't have a choice now.
What is, what is prone?
Proning is turning upside down. So when you're face down, and you want to like angle yourself to where you can drain your lungs, but you want to do it for a couple hours at a time. And what makes it uncomfortable for most people, when you are in the bed, and this is why we have a lot of hospital pneumonias, is because people are bedridden and they're not up moving around, so that fluid settles in the back of the lungs.
Yes.
So what you do is you flip over to kind of help dissipate all that and help to improve the oxygenation. And you can watch the oxygen monitor shoot up once it starts to happen. And people have been doing this for years, long before, this was a big thing on the news. We've been doing it in respiratory care. It's called percussion and postural drainage. We angle the patient, and put them in all these different positions that people think we're torturing them in, but it's to help drain the lung, because it works. As long as it's done properly.
Right. I was introduced, you introduced me to Dr. Mike Hansen, and he actually said to do that they've been doing that now, and that's been helping.
It does, and that's the first. We have rotoprone beds, and we usually use those in a lot of hospitals, but they are expensive. Some hospitals don't have that resource. So the residents on day shift have got this down to a science. I love proning with them because it's over and done with, but they've kind of put a blanket over the top of the patient, and then they take the sheet that's under them and they roll it up on the sides and they make them like a burrito. And we scoot them over and then we flip them. And it's really quick. When you don't have that coordination, it does kind of get cumbersome, especially with dead body weight and a bunch of little women. So to have that process is really good. But those beds, we use those in ARDS. I constantly, and you need to do it early on when it begins to happen. You don't wait until you get bad and do it. You do it from the beginning. And if we can get the patient to tolerate it, you know, even with some anxiety medication, because that fluid puts up some pressure when you flip over. So it kind of feels like you got some sandbags back there until that fluid starts to dissipate. And they will start to cough and hack. If you're coughing, that's a good thing because your airways are reacting to that and they're opening, and you really need to focus on. I actually had my one guy who's actually walking and talking. I taught him how to meditate, and it's a technique I learned. You know, I used to have really bad anxiety, and I meditate. Like, that's what's getting me through this is meditation.
Love it. Yes.
Oh my Lord. But when I left, I had introduced him to a few of the guided meditation apps that I use, and because he did not want to flip over. I'm like, look, you've seen the craziness in the hallway today. You know, this is what's going to happen to you very quickly if you don't follow the advice. And I even showed him the autopsy of the inflamed lungs. I'm like, look, this is what's happening. You are at high risk because of everything else that's going on. And just because of race and whatnot. And when I left, he was flipped over, prone, sound asleep with his meditative music, and he was doing good.
I love it. I love it.
It works.
Meditation does work. I've been meditating since this happened. I'm trying to find, I just want to ask you a question about the blood thinners that we were talking about before. I just want to get the question. So somebody had asked, since COVID-19 causes blood anomalies and causes blood clots for the patients who even got blood thinners, do you think the virus works in the opposite ways?
I don't, just because of what we're seeing. There are certain levels in the blood that we look for clotting factors. One of them is like your D-dimer. And anything above 1,000 is indicative that we're going to have some issues with clots. But I've seen numbers that are just astronomical. I'm looking at them going, is this even accurate? But there's a lot of lab values that we look at to do with the clotting. So to not give a blood thinner in those situations would be like trying to pump nasty oil through your bloodstream. I mean, it's just not going to go. So now you're going to have sludge. It's going to pool up in your heart. Your heart's going to enlarge, and then you're going to have more problems. So I don't think it works backwards. You do need to give that. Most of these patients are on a heparin drip because what we're seeing is a pattern of behavior. Just like these children that showed up, they're having the same type of inflammatory responses. That little girl that was just put on Ecmo started with a blood clot in her leg. So we are seeing this pattern. I don't know why it's delayed in children. We don't know. At first, we all thought that kids weren't getting affected, and it was like, great, at least leave our kids alone. You know what I mean?
Right, right.
But now they're showing up in DC, Michigan. They're popping up everywhere.
Misty, what's the ages? Do you know the ages for these children?
They vary. And a lot of, they keep talking about a Kawasaki's disease on TV. That's a big thing that everybody's hearing. Kawasaki's happens usually between birth and 5 years. These other kids are like between the ages of 5 and 12.
Wow.
So they have a lot of the same symptoms. And one of the research articles from 2010 that I had shared that was on, I always pronounce his name wrong, but he's the doctor on the MedCram videos. He's a wonderful pulmonologist out in California. But he's in contact with the doctors in New York, and they share the information, and he makes these really great videos for medical people. They're a little bit wordy for some people to understand, like for the layperson, but what they're seeing and what they had found in some research was that it appears that the Kawasaki's is a response of the immune system to a virus.
Mm-hmm.
Now we have this going on outside of that age range of Kawasaki's. So now we have even more research to do. But they're very, very similar in their behavior. We see in the adults and even in the kids. My friend who's a respiratory therapist in Michigan, her son was really, really, really sick in January.
Yeah.
And he had these really weird ulcers on his fingers. Well, now we're seeing them with the COVID patients because it's a blood
Wow.
vessel issue and the endothelium is dying off. And then you have these weird looking fingers and toes that look like ulcers and blisters.
Wow.
It's from the damage to the blood vessels in there because all of your nerve endings and all your capillaries, they end in your fingers and toes. So when you damage all them, there's a lot in there. So it's causing that. I just had somebody message me last night. This guy got discharged from the hospital on the news and it looked like his fingers had frostbite. Like, you are very correct. We call it COVID toes, and it's also happening on the fingers.
Wow.
So we're seeing a lot of patterns. I kind of think that this virus was a blessing in disguise because it kind of gave us an insight into other issues. And maybe, you know, if we figure this out, we can help to figure the Kawasaki's out, because we definitely don't need children as young as birth to 5 dying of blood clots and other major heart problems and strokes. So I hope that, you know, I would encourage all the high schoolers to go into into the scientific field, because it's going to be a hot career for the next couple decades over this.
If somebody was tested positive, and then how long does it stay in your system for? Do you know?
We don't know. We don't know. There's 2 different types of tests. There's the antibody blood test, which can give us 2 bits of information.
Mm-hmm.
It can tell us if you've been exposed in the acute stage, which is like now, and it can let us know, you know, because there's 2 different immunoglobulins that will show up. In the chronic phase, which is, you know, usually beyond 7 days, it will let you know at some point in time if you were exposed. But if we really want to know if you're sick right now, is the nasal swab. There's a downside to both of those. The nasal swab is only as good as the sample that was taken. So if they haven't gone back all the way to practically to your brain and made you cry to get that swab and turn it in there real good and got a good sample, then you could test negative if they didn't go back far enough. The antibody test, we're getting false positives and false negatives. So there is, and that's another thing with the American public. We're pushing, you know, we need tests, we need tests, we need tests, but we also need quality control.
Right.
The test accuracy is only as good as the quality control. And if we don't have time to test the quality, we're not going to get quality. And, you know, this kind of happened in March. It kind of blew up. So, I mean, for us to come this far was, you know, economic checks and research and drugs and all this to be happening. When I look back, I'm like, God, this really hasn't been going on this long. And people are like, I can't take it anymore. And I'm like, oh my God. When you look back to what they did during the 1918 flu, the cities that maintained the strict social distancing rules and the lockdown are the ones that flattened the curve the most. The ones that opened the floodgates too early had resurgences. And we can't handle a resurgence right now. I'm going to tell you what, the healthcare industry is exhausted.
Yeah.
So all these people who are furloughed, they can come take my place and I'll go home for a month and recharge and come back and swap out, because there are jobs available in the medical field if you want to travel. If not, then don't complain, because we are out here. I mean, that really makes me angry when I do see those posts that, oh, we're out of a job. There's jobs. There's lots of jobs. There are. You can come help out temporarily until things pick back up. We can use all the help that we can get out here, because we're tired.
Of course you
It's
are. Of course.
mentally draining to even deal with this amount of uncertainty, honestly, because we're all holding a very, very collective breath about reopening, because it's like it's too soon. We are still seeing cases. They just sent the, I just passed, because I'm in the Hilton here, and it's pretty much just healthcare workers and soldiers here. And the soldiers are at, I think, the university hospital helping out. And they're just sent some home today. They've kind of returned to baseline. That doesn't mean that, you know, oh, the military went home and everybody's going home, we can handle going out. No, that's not what that means. It means we've returned to a level that we can function at. But if we get overwhelmed again and push capacity, we really don't have the resources. We really don't. We are short on some of the supplies that we need in the hospital because everybody is using them right now across the country, across the world. They're all dealing with the same things. So those common supplies that we need, we don't have. So I am praying that they don't reopen right now. I am praying.
Misty, what's your frustration with the media and
They're
all the
not
misinformation?
They're not giving either the whole picture or providing people with the, you know, like a lot of the things that I see, it's only partial truth, or they have extracted one highlight out of a huge story to focus on. But it's like when you have a debate, like with a presidential debates or any kind of debate, you look at your opponent's argument and you look at your arguments and you prepare for all of it. They're not doing that. They're just giving you this one little bit of detail and they're feeding upon it. And like even the headlines that I see are misleading. You know, like, oh, and then you read it and I'm like, that's not what this is about. You know, and it's just right now I really miss like Walter Cronkite and Dan Rather, like those kind of guys, because they just kind of reported the facts. Yeah. And they gave people the tools that they needed to understand what they were hearing. Statistics is not an easy subject for anybody by any means. And they need to have somebody to explain these things. And they're throwing all these numbers up here that people are focusing on, but they're not understanding the math behind it. Yeah. So they don't even know, like they'll argue with me on I've had some interesting arguments on my rant video about what I'm saying. And when you try to tell people and educate them, either they get very offensive and defensive. Yeah. And there's just no reception, but it's because of what they're seeing on TV and it's just propagating it. You know, there really shouldn't be protests going on right now. No. There should be unity and helping each other out. And, you know, there's a lot of innovation I was watching on TV today. Online sales are up so much that they're comparing it to like Black Friday. Wow. Audiobooks, like even book sales through the roof. You know, there are ways to make money through this. Use some innovation and be creative, because I have seen like in New Hampshire, the fishermen they have created a Facebook group. They've used social media for something positive, and they're going dockside to go get their fresh fish. Right. And going right to the source. It's not going through a market. And they have figured out a way to make ends meet. There are ways. There are a lot of ways to do this, but people are so resistant. As soon as you tell them you can't do something, it's like the human mentality is like, oh, you told me I couldn't, so I'm going to fight. It's just like a child. I feel like we are in a kindergarten classroom sometimes. Yes, ma'am. Yes, ma'am. You got that right. Especially with social media. Everybody has ego. Everybody's correct. Everybody else is wrong. Everybody else is a jerk. It's the worst thing I've ever seen in my life. And that's the worst part about this is all the fighting that's going on, because, you know, it's your main priority right now as an American is not to get this virus. That should be number one. Because what we look at with this thing with herd immunity and all these other statistical values is for, you know, whoever gets infected, how many people do they infect? So even if you're not symptomatic, you don't give a damn about the people around you. And that's what my rant was about. You know, like,
Yeah.
you just don't care. That's selfish.
Correct.
And, you know, your fears don't trump my rights. And I'm like, we are in the state of a national emergency. Those
That's
rights and
correct.
liberties can be suspended. Our forefathers did not write the Constitution for. I don't think they had the idea that the Democrats and Republicans and all these political parties were going to fight and hate each other. I'm like, didn't they work together to write this beautiful document and declare our independence? Like, they worked together. They weren't calling each other names. You know, I don't see any documentation of that in history. What happened? You know, and people are so full of hate that if you don't, I just had one of my neighbors in Texas. I mean, she is fixated on something that she's never even talked to a person about. You know, she made an assumption and she thinks that, you know, this is the way it is. And she never talked to the person to even see if that's how they really felt. She just assumed it. I'm like, look, I cannot deal with this right now. I thought that you understand, you know, I thought that you approached things a little bit differently and that you didn't make negative assumptions about people and that you allowed people to grow and change. But you know, this is kind of hypocritical. I just don't have room for this in my life right now.
Correct.
You know, and she's like, go save the world. I'm like, you know, one person at a time. You know,
That's right.
I'm not going to, I have tried to find some kind of positivity amongst all of this negative because there's a lot of death. I had some guy wanting me to go take a picture of the semi trucks in New York that were holding the bodies for the morgue. And I'm like, that is just sick and twisted. But they want that wow factor. And what would that have proven? If I would have done that, they would have come up with something else. You know, I'm not going to play into that. Yeah. I will educate you and you can fly your butt out here and you can look and see for yourself. And that these streets are vacant. I mean, it's really, when I got here to New Jersey, I started walking around just to kind of check things out. And even the homeless people are wearing their masks and maintaining social distancing.
Right.
They don't even have access really to the television, and they even understand how serious this is. And I don't it's like, and until it happens to you, I learned that with dealing with being a soon-to-be ex-spouse of a combat veteran with severe PTSD, but that until you live it and understand that, oh my God, this is what it's like, you don't get it. And now I'm going to have a bunch of my frontline healthcare workers like me coming back trying to deal with trauma. So I've got 2 Facebook pages. I just started my business licensing process because I'm going to do something with this. I have some ideas. I don't know what's going to evolve from this, but I definitely want to get into some kind of education for both because they are going to tie into each other. And I'm afraid to see how many PTSD diagnoses that we begin to have after this. This is because we've had some people just break down in tears. I can't do this. I just can't. They thought they, you know, were going to come, but just the level of stress that we're under and working under those conditions. And you've seen, I'm sure there's that Facebook video of the nurse, you know, telling people that they're murdering. Okay.
What do you think about that?
I think that was a very emotional reaction. What's happening is we are short-staffed. The administrators are putting people in a position to make, you know, to work with critical care patients that have never done it, or they haven't done it since clinicals, which were years ago.
Right.
And there might be a mismanagement of care. I do not believe it's intentional. I really don't. We are all working under a significant amount of stress. There are going to be mistakes that are being made just because of the nature of what's happening. And we don't know. But what she should have done is composed herself in the bathroom and not gone on social media and called us all sociopaths.
Correct.
There are agencies like OSHA, the Joint Commission that accredits the hospital. There's ways to go about, you know, she's like, I don't know who to talk to. Yes, you do. We're all trained. We are trained on who to report things like that to and how to report them. Some better than most. And what she did was put more fear in people to even send their loved ones to the hospital. Now, I've given the amount of mortality rates on the ventilator, it's high.
Right.
You know, if you're above the age of 65 and get put on the vent, you get a 97% chance of death from the admission rates that we're looking at in New York City. And that's high. You know, we're doing everything we can. And a lot of times there's just nothing that we can do anymore. And it's not that we're giving up. It's not that we're not treating the patient. It's that there's just, we have to, when the soldiers go out in combat and somebody's injured, or like with 9/11, we have what's called emergency preparedness. We have to assess who can we save so we can divert those very limited resources, because we're on back orders for dialysis chemicals, reagents for these tests. We don't have resources. So if we exhaust a bunch of resources into a patient who's got about a 1% chance of living, but those same resources could save 15 other people who have a high chance of living, that's what you do in a disaster response. And it's backwards from what we're taught. And a lot of people think that we're being very cruel. And that's not the case. It's that we have to limit those resources to the people who have the highest chance of a positive outcome. And I think that some people have a hard time handling that concept. And it's a hard thing to understand. But, you know, if you have 15 pints of blood and somebody's hemorrhaging and they're not going to live, you know, there's just no chance. But you have some people with minor injuries that blood could save. You have to look at the least amount of casualties. So I really think that's more of the situation that was going on. It wasn't the fact that we were murdering people and just ignoring their care.
Right.
It's that the resources aren't there to be abundantly, you know, we waste a lot in America. We waste a lot of food.
Yes.
We don't need to waste a lot of healthcare resources during a time where we don't have them. So I think that's kind of what happened, and it could have been handled a little bit more professional manner. It's like my director, she talked to me yesterday. She found out about my rant because I think a relative had like, it's like, you got to see this. She's like, that's my conference room. But I'm aware of, you know, don't make the hospital look bad. You know, don't say things that are going to put people in positions to have to defend, you know, everything that we're doing. And that's not what I had done. I was using it as a teaching mechanism. It's like, this is where the guru came from, and stop with the protesting. And it was nothing to do with my coworkers. And, you know, I just left all that out and just tried to use it as a teachable moment. So she's like, you know, her and I we had a long talk yesterday. It was actually a really good conversation, but it was really funny to find out how she found out about this video. I was like, oh, sorry.
I'm glad that you're out there doing all this, though. I mean, you know, and if this is just, you know, it's a very difficult time. Are you afraid when we start opening? You guys
Yeah, we're all afraid. There's not a single one of us who is resting well at night because we just don't know. And, you know, we're already seeing things that are already not, we didn't predict happening. Like I said, just a few days ago, the ICU was half empty and they were starting to like shut down certain areas and move the nurses and not need so many. And then all of a sudden the other day it just exploded and it was like, oh my God, what just happened?
Right.
So it is up and down and up and down and up and down, and we can't predict. And that's another thing, all these models that predicted these high fatalities, well, we were using the numbers that we, you know, were looking at from other countries, but our numbers are low. And it's because we did lock down and we did, you know, take control of things. Could we have done it earlier? Yes, but we didn't know from the data that we had how serious this was going to get and what exactly was going on. And when it was abundantly clear that we were getting overtaxed, we shut it down. Now, what happened in El Paso, I'm right near a military base. The military brought everybody back to their base. There was a lot of soldiers who came back from New York. Well, guess what? They tested positive and brought it back to base and spread it.
Wow.
They should have sheltered in place and not brought those people back. They should have just left them where they were at until things calmed down and it was safe to do so, and we had a better understanding. But they brought back everybody from deployments, and we can't react to something that we don't know. This is a novel virus. It is new. This is new. I mean, very new.
Yeah.
And now there's all these conspiracy theories with the contact tracers, and we need them. And we need people to cooperate because we are trying to trace when it got here and how.
Right.
We are not, I've seen this ridiculous comment today that you're letting them into your home and they're going to come confiscate everything and quarantine you and do it. No, they're not. No, they're not. They're just trying to get the data that we need to track this virus's mutation, because what they have found is that the virus in New York is a different mutation than the virus in Washington.
Wow.
Why?
Yeah.
I'm trying to answer that question. We can't do that with people and their 5G conspiracy theories and the contact tracers. And I'm just like, is there any help for us? Is there? Because it seems like, the more and more, and, they had taken down, I got so many emails over that pandemic video. And I know how Z-Dog felt because he's got 1 million followers.
I could imagine what.
And I'm like, oh my God, and he answers everything personally too. And I have personally messaged him because I did ask him, please do an interview with a mental health professional about PTSD and mental health awareness in our medical, and he did, like within like a week and a half.
Oh, wow.
And, but he does take the time to answer everybody if it's logical. But I mean, I could just imagine how many messages he just deletes, because I don't even remember people's names, but I'm having good conversations with people. But what I don't want them to, and that's why I do the live videos, because everybody's situation is different. So if one person is asking if they should go get the antibody test, or one is looking at getting the swab, the situation could be different, to where one, it would be better off if you get the test, another one would be better if you get the swab. It depends on your situation. So I don't want people taking it and using it as a blanket, you know what I mean? Because everybody is different. It's a case-by-case basis. So the live videos last so long because I do answer questions repetitively.
Right.
And, I'm going to do one tonight, and I guarantee you people, because I fell asleep the other night. I got home from work and I was just so exhausted because I've been working days and nights with one day off in between. So I'm trying to get my sleep balanced, and I'm in mountain zone, with my body, and now I'm out here in the eastern side of the, of the country. So I'm trying to keep my immune system healthy, so I don't break it down and get this, so I can continue to help people.
That's right.
But there is a huge need for education. I mean, this has been abundantly clear through all of this, that there is a severe lack of education. And I really hope to bring some kind of comfort in that. I got people from Australia following me.
Love it.
Other countries. It's insane. I don't know how.
Where can people find you?
I have the Facebook page. It's called RT Says What. One of the girls, I was trying to come up with a name for the page because I knew I needed to create it after my personal Facebook got bombarded. And so one of the coworkers was like, well, because I'm like, I don't want to do like respiratory rants. And she's like, how about RT Says What? And I'm like, that's great, because it's not negative,
Yeah.
And then there's my personal Facebook page. I have opened it up to public stuff. I do hide like the ridiculous comments. I have to call out to a corporate compliance hospital in California when I get done, but somebody violated HIPAA on my own Facebook page. It was great.
Oh, jeez.
Yeah. And
you're so exposed right now. That's the whole thing.
So I try to monitor what's going on. If if there's something that's just completely inappropriate and not helpful, this is my personal Facebook. I don't mind. I have been accepting a lot of friend requests, but the one that I use that I've had forever is Misty Huffman, and then it's got my maiden name in a parentheses, and it's VEE. I have another one that I use, but it's just for positive things and lots of cats. I go there to look at cats. It's calm. There's no news. There's no drama. So I have that one, but I don't use that as often as I do my regular page. Everything is managed through my regular page, and I don't mind adding people. Although I've had a few weird marriage proposals and people stealing military people's identities to romantically get in relationships. But, you know, I'm a fact checker, so I don't have to worry about that. So as long as things are under control, I don't mind, because I've been doing the live videos through my personal Facebook page. I do want to get everybody over to the other page, but I think I'm going to wait till the following gets up and more people are, you know, paying attention to, hey, let's move it over here.
Are you on Instagram?
Sorry. I am, but I don't use it as much. But one of the guys I work with, he wants to get into respiratory consulting, and he's kind of on the same page I am with the education.
Yes.
And he's under respiratory_RAPH, RAPH. And I did add him to my Instagram following because he has a lot of great information, like respiratory wise, on foods that help reduce inflammation. And that's another thing right now.
Yes.
People are wondering what they can do. Correct. Your diet. Your diet is a big one. Eat your fruits and vegetables. You need those antioxidants. That's what your body uses to build, you know, to bolster its immune system. Do not go out and buy a bunch of over-the-counter supplements. It's not going to help. I mean, people are clearing out vitamin C, and I shared, you know, where that study came from, and it's under a severe amount of stress. It may help, and that was in soldiers who have lost limbs, you know. People buying vitamin C in mass quantities. All these vitamins are water soluble. There's only vitamins K, A, D, and E are fat soluble. So if you take those, you need to eat fat with them for your body to absorb them. The rest of them get peed out, which is why when you drink a Monster, your urine's bright yellow. It's all those B vitamins. Your body doesn't store those. So you're not doing it any favors. You're overloading your kidneys and your liver to have to process all these things.
That's right.
When just take a daily vitamin and eat right, because you need to keep your body mass index low. And if you do that, you're not going to have heart problems. You're not going to have diabetes. That's one thing that we're seeing with all these people coming in, even if they don't have diabetes, they're presenting with diabetic ketoacidosis.
Wow.
The body is going into a state of oxidative stress. This is not the flu. We don't see this with the flu. With the flu, the antiviral that we give, you're supposed to give it in the first 24 to 48 hours of symptoms. And that's the Tamiflu. And it helps to stop everything in its tracks. We don't have that. These antivirals that we're using, it doesn't work that way. And with the Tamiflu, you don't take it for, 10 days. It's a completely different course of action, I'm trying to say, like a totally different clinical course that this is going on. And what people are, saying, oh, it's just the flu. No, and they're like, and that's another thing with them comparing it to numbers for the flu. That's during a whole season. This has happened in a matter of weeks.
Correct.
So when you look at those numbers and the ratio, like, let's go back to basic algebra. Look at the ratio. There's a whole heck of a lot of people in a short period of time. And that's not the flu. That's so not the flu.
Sorry.
I was actually asked to do a short video, so I'm going to work on that, on just educational information about how this is not like the flu. And I have to get comfortable with my new video software. So I'll be making lots of short videos.
You know what I wanted to ask you was, what was the governor talking about that people are getting the virus when they're at home? Is that coming from the outside?
We don't know. He was just that day that he was, because I was watching that news broadcast. And that was just the day that I happened to be off work and I was catching it. And he had said during that broadcast, it was odd that 66%, but if you looked at the number at the bottom of the screen, this is where statistics are important in math. 45% of people questioned didn't answer. So of the people sampled, 45% didn't even answer. So
Oh,
nobody
so
focused on that number at the bottom of the screen, but it was an odd finding is what he was getting at that day. We don't know. And that's why the contact tracing is important.
mhm,
We surveyed these people, but now if we trace back to where they've been, because what we're seeing is that, you know, we have an incubation period. With the flu, you get exposed 1 to 3 days, you're getting symptoms. This is happening 10 to 12 days later. So I don't know where the heck I was 2 weeks ago. I have to
right,
look at my Google Maps timeline. I don't even know what day it is anymore, and
right.
let alone if it's night or day.
Yeah,
Because of my shifts, but people don't remember that. They might go, oh, you know what? I did run out to the store that day, or I did go to, you know, I went to my son's house or something. We don't remember. That's why contact tracing is important. They can help people take those steps and go, oh, let's take a look at your Google timeline, because a lot of people don't realize that if you go to your Google Maps up in the upper left-hand corner, there's those 3 bars. You click on it, hit your timeline. You can look at everywhere you've ever been
mhm,
as long as you have your GPS on your phone.
right.
So it's really important to look at the whole picture. And it was just a very ironic finding. But like I said in the beginning, they had sampled it was an area out in California that was having a large outbreak. And when they sampled those people, the only coincidence they had was that they left the house to go to work. So you have 2 completely opposite findings with asking people where they've been.
Mm-mm.
So that's why it's important for the contact tracing. We need to help out instead of hinder, and conspiracy theory, you know, that's not helping matters. None of that is helping anything.
Are you afraid that you're going to catch this? Do you get afraid of that?
I do get afraid, like with my throat from all the talking. I'm like, okay, do I have any symptoms other than this? Because I have IBS and my stomach does, and that's one thing that we're seeing with this is gastrointestinal pain.
Mm-hmm.
A lot of people are coming in with GI symptoms. Only 31% of people are presenting with a fever. Not everybody gets a fever.
What's the symptoms, Misty?
We see nausea and vomiting and GI pain, like major abdominal pain.
Mm-hmm.
That's one of the most common complaints actually that I've seen, especially in my critical patients when I go back and read like when they present to the ER. I go back and look, and then I look and see where they're at now, and I look and see what drugs that they're on and where we're at in the clinical trials, and have they improved, have they gotten worse? And the majority of the time is there's no improvement. Because once they get to me, it's a pretty bad situation. But only 31% present with fever. Some present with shortness of breath, not all.
Mm-hmm. Mm-hmm.
What we're seeing with some of these people is we call them happy hypoxemics, and hypoxemia is low blood oxygen. And they're breathing quickly, but they're not blowing off carbon dioxide because they're getting those full lungfuls of air.
Right.
But it's affecting, we think possibly the respiratory center in the brain with the infection getting into the spinal fluid. So they're just, and what we have to support is that work of the respiratory system because they're breathing so fast. All those muscles can wear out from breathing like that for too long. So we try to support that with things like BiPAP, and lots of oxygen. We definitely don't, it just goes 100%, and then we work our way down from there. But a lot of people are presenting with abdominal symptoms. It's not just fever. So getting your temperature taken, when you walk into work or when you walk into a place, it's not a way to say that you don't have it. You know what I mean? With only 31% presenting with a fever, that's very low to be able to use that as a judgment. You know what I mean?
Mm-hmm.
A lot of it is in the belly. And those receptors that virus is binding to are found in the gut. So it makes a lot of sense for it to be there. It's not the conspiracy, it's the ACE2 receptors are what it's binding to, and where we're having a lot of these problems. And they're found throughout the body, a lot of it in the blood vessels, the heart, the kidneys, all these areas, they're finding it in the autopsies.
Oh, it's you guys got your hands full, and I want to thank you so much for coming on here and speaking with us. Hopefully we can have you back. And
Absolutely. I hope we don't have to do an update of insanity after, because I don't even know when they're supposed to start reopening. I haven't heard much of a plan.
oh boy, yeah,
I think we're just
mhm.
waiting for things to just level and stay there for a minute before we even attempt to do this.
Yeah, me and my family, we're just going to stay at home and we'll wait out until next year.
That's the best advice. And, it's really scary about school, and they're using peroxide foggers to help sanitize our N95s. They're doing it on the airplanes in between flights. I looked online and they're very cheap. And the school systems, I really think, need to invest in those.
What is it called, Misty?
They're a peroxide fogger. I seen on one of the news on Facebook, because I'm from Michigan.
Mm-hmm.
I think it was MSU, Michigan State University. They were helping out with these peroxide foggers, and the company that manufactured them was going to keep them cheap because of they were flying off the shelves, but they were not going to try to capitalize on the virus. They were going to make them affordable. And I happened to Google some online, and they were only a couple $100. I don't know what areas that they cover, but for a couple $100, if you can stick, really, that's pretty affordable. And it fogs, especially in a gymnasium where all the basketballs and the hoops are. You could stick that in the closet, run it. I think it's not very long. It's not. And also the UV lights. We use those in the hospital. They have a little robot thing they wheel into the room after they clean it, and they zap it. And you don't have to worry about human error messing up, not getting a surface cleaned.
Mm-hmm.
And, both of these are pretty affordable for the average business owner to be able to do that. And the school systems, I really think that the school systems need to work on some better infection and hygiene. And that's one way to do it at a very effective cost.